All right. Hey, everyone, and welcome back to another deep dive.
Absolutely.
Today, we're going to be focusing on some pretty
Cool, huh?
important stuff you guys are going to see a lot of as nurses,
That's right.
ARDS and pulmonary vascular disorders.
Yes.
Um, we've got a ton of research here, a ton of medical texts,
Sex.
but don't worry.
Yeah, we've condensed it all.
We've boiled it all down
To the need to know.
to the need to know.
For you busy nursing students.
Exactly. So think of this as like a cheat sheet,
Yeah. Your secret weapon.
your secret weapon for your next respiratory exam.
Absolutely.
Way more interesting.
Definitely more interesting.
Okay, so first up, ARDS.
All right.
Acute respiratory distress syndrome.
Acute respiratory distress syndrome.
So what is it, really?
Yeah, what is it? Well,
It's like your lungs are having a major meltdown.
it's more than just a cough, right?
Yeah.
Think of it like a house fire in your lungs.
Oh, wow.
That's the inflammation going wild. And then the firefighters come in with their hoses and everything gets soaked.
Oh, my gosh.
That's the fluid buildup.
Okay.
And suddenly it's hard to breathe because oxygen can't get in.
Oh, that's a terrifying image.
Yeah, it's a serious condition.
But here's the thing. ARDS itself
yes,
isn't actually a disease.
it's not a disease.
It's a reaction.
It's a response to an injury or an insult to the body.
Okay, so as nurses, we have to be detectives.
You got it.
Figure out what's causing it.
Exactly what triggered this cascade.
So, like, what kind of things?
Well, you got things like near drowning,
Oh, yeah.
inhaling toxic fumes,
Might.
sepsis, pneumonia,
Okay.
even pancreatitis.
Wait, pancreatitis.
Pancreatitis can do it, yeah.
Huh. That's wild.
It is. The body's a complex system.
So how does ARDS actually progress?
So think of it in 3 stages.
Okay.
You have the exudative phase.
Right.
That's the initial injury, like the fire we talked about.
Right. The fire.
Inflammation, fluid building up.
Okay.
Then you have the proliferative phase.
Okay.
The body's trying to repair the damage, like a cleanup crew coming in.
So far, so good, right?
Well, not always.
Oh, no.
Sometimes it progresses to the fibrotic phase.
Uh-oh.
That's where scar tissue forms in the lungs, making it hard to breathe permanently.
Okay, so this is serious stuff.
It is.
So as nurses, how do we know if a patient is going down this ARDS path?
Well, first you'll notice them struggling to breathe, using all their muscles.
Okay.
We call that dyspnea.
Right, dyspnea.
Classic sign.
Okay.
You might hear crackling sounds in their lungs when you listen with your stethoscope.
Like those Rice Krispies?
Kind of, yeah, but not as fun.
Definitely not.
And here's something that might surprise you. Giving them oxygen might not help much.
What? Really?
In ARDS, the lungs are so damaged that oxygen can't get into the blood effectively.
So what happens if it keeps getting worse?
Well, then you might see cyanosis,
Cyanosis.
where their skin turns bluish.
Oh, that's definitely not good.
No, that's a sign that their oxygen levels are dangerously low.
Okay, so let's switch gears and talk about what we can do.
The action plan.
Yeah, what's the action plan for these patients?
So one of the main things we do is mechanical ventilation,
Okay.
and especially with PEEP.
Right, those little air splints for the lungs.
Exactly. It helps keep those tiny air sacs open.
I remember we talked about something called proning, too.
We
Is
did.
that something we really do, like flip them on their stomach?
We do, yeah.
Seems counterintuitive.
I know, right? But it can really help improve oxygenation.
Wow. Never would have guessed.
Sometimes you got to think outside the box.
And our sources mentioned meticulous oral care as well.
Oh, absolutely.
That seems like such a small thing.
It is, but it can prevent ventilator-associated pneumonia.
EAP.
VAT, exactly. A serious complication.
So it's all about those little details.
It is. Every little bit counts.
So let's move on to pulmonary vascular disorders.
All right, let's tackle those.
These are all about problems with blood flow in the lungs, right?
Exactly. Think of it like traffic jams in the lungs.
Okay, I like that analogy.
And one of the worst culprits is a pulmonary embolism, or PE.
Oh, yeah, PEs.
It's like a rogue blood clot
That-
decides to take a vacation in your lungs, gets lost, and lodges itself in an artery.
Okay, not the kind of souvenir you want.
Nope, not at all.
So this blockage causes, what, a ventilation perfusion mismatch?
Exactly.
So air's getting in, but blood can't get to those areas to pick up the oxygen.
You got it. Like a working engine, but a flat tire.
Yeah, you're not going anywhere.
Exactly. And just like a flat tire, we need to act fast.
How do we do that?
We use tools like CT scans,
Okay.
D-dimer tests,
Mm.
VQ scans,
All those imaging studies.
to pinpoint the location and size of the clot.
So once we found the culprit, how do we stop it from causing more trouble?
Well, our main weapon is anticoagulants.
Okay.
Like heparin, think of them as tiny traffic cops, preventing more clots from joining the party.
I love that.
Got to keep those roads clear.
But what if the clot's already causing a major backup? What are our more drastic options?
Well, in severe cases, we might use clot-busting drugs called thrombolytics,
Okay.
or even surgically remove the clot in a procedure called an embolectomy.
Wow, that's getting pretty intense.
It is. These clots can be really
It
dangerous.
really highlights how serious this is.
Absolutely, we don't take them lightly.
So we've talked about fires and traffic jams. Now, what about pulmonary hypertension?
Pulmonary hypertension.
That's the one where the arteries in the lungs are like a pressure cooker, right?
That's the one. Constant pressure in those arteries.
And that makes it harder for the heart to pump blood through the lungs.
Exactly. It's like trying to push a thick milkshake through a tiny straw.
Okay, I can visualize that.
The heart has to work much harder.
And that can lead to problems, right?
It can, specifically right-sided heart failure.
Right, because the right side of the heart is the one pumping blood to the lungs.
Exactly. It takes the brunt of the force.
So we've got a lot on our plates as nurses trying to manage all this.
We do, but that's what makes nursing so challenging and rewarding.
I completely agree. It's about using our knowledge and skills to make a real difference.
Absolutely. We're in a position to help people through some really tough times.
And I think that's a perfect place to stop for now.
Sounds good.
We'll pick up the conversation in part 2 of this deep dive.
Can't wait.
See you there.
See ya. Okay, so let's get practical here.
Yeah, let's dive into the nursing interventions.
Put on those nursing caps.
Yeah.
All right, let's start with ARDS. You're on your respiratory rotation.
Okay.
You've got a patient with ARDS.
Right.
What are your priorities?
So this patient is really in trouble. Their lungs are basically on fire.
Right.
So what's the first thing I need to do?
First and foremost, you're going to be their lung bodyguard.
Okay. Their bodyguard.
You'll be monitoring their oxygen saturation like a hawk,
Right.
watching their breathing patterns, and listening to those lungs for any changes.
So I'm basically listening for those Rice Krispie sounds, but this time it's bad.
Yeah, not so fun anymore.
Definitely not.
Any sign of increased shortness of breath, a drop in oxygen levels,
Okay.
changes in those breathing sounds, it could mean trouble.
Right. We need to act fast.
Exactly. ARDS doesn't wait around.
No, it doesn't.
Early recognition is key.
Okay.
And remember, these patients are often on mechanical ventilation.
Right. The ventilators.
You need to be comfortable managing those settings, especially PEEP,
Right. The peeps, those little air splints.
keeping those air sacs open.
So important.
And we also talked about proning.
Yeah. Flipping them on their
And
stomach.
that's something nurses actually do.
Yeah. Is that something we actually do?
We do.
It still seems so counterintuitive,
I know, right?
but it can really help.
It can. It can really help improve the oxygenation.
So turning a critically ill patient on their stomach can actually help them breathe better.
Sometimes, yeah.
Wow. Amazing.
And while we have all these high-tech tools,
Right.
don't underestimate the power of good old-fashioned nursing care.
Yeah.
Things like meticulous oral care, suctioning, these can make a world of difference
Wow.
in preventing infections, helping those lungs heal.
It's amazing how the small things can make a difference.
It is. It's all about the details.
All right. So let's switch gears again.
Okay, let's do it.
Let's talk about pulmonary embolism, a PE.
Okay, PE.
So our patient has a rogue blood clot
Yeah,
causing a traffic jam in their lungs.
right.
What do I need to focus on as their nurse?
Again, you're going to be on high alert,
Okay.
monitoring their respiratory status, looking for any signs of trouble.
Okay.
Shortness of breath, chest pain, a drop in oxygen levels, anything that indicates the clot is causing problems.
So we got to catch it early.
Absolutely.
And I remember you said those anticoagulants
Yeah.
like heparin are our frontline defense,
They are. Think of them as tiny traffic cops.
keeping things moving.
Exactly. Preventing more clots from joining the party.
But those anticoagulants, they could have some side effects, right?
They can. Bleeding is a big one.
Right, bleeding.
So we have to be really careful and monitor for any signs of that.
So we're preventing more clots, but also making sure the patient's not bleeding too much.
It's a delicate balance.
Yeah, a tough job.
But one that we, as nurses, we have to master.
Right, it's part of the job.
Now, another thing to keep in mind,
Yeah.
that clot, it can put extra strain on the heart,
Oh, right, the heart.
potentially leading to right-sided heart failure.
Oh, so I need to be checking for things like swelling in the legs, distended neck veins.
Yes, all of those things.
Changes in their heart rhythm, all that stuff we learned about.
Exactly, you're catching on.
Got to put it all together.
It's all connected, seeing the bigger picture,
Right, connecting the dots.
anticipating problems before they become emergencies.
That's the key.
That's what we're here for.
Okay, now what about pulmonary hypertension?
Pulmonary hypertension. So
Yeah.
unlike a PE,
Right,
which is a sudden event,
right. Sudden blockage.
pulmonary hypertension is a long-term condition.
Okay, long run.
Needs ongoing management.
So what's our goal?
Our goal is to support the patient, improve their quality of life, and slow down that progression of the disease.
Okay, so how do we do that?
Well, it starts with those medications we talked about earlier.
Right.
Vasodilators and diuretics.
To help reduce that pressure in the lungs.
Exactly. But it's not just about giving pills.
Right. There's more to it.
It's also about educating our patients.
Educating, yeah.
About their medications, how to take them properly.
Right.
What side effects to watch out for, why it's so important to stick to the plan.
So it's a whole person approach, not just treating the symptom.
Absolutely. It's about the whole person.
And I know lifestyle modifications are important too, right?
They are things like regular exercise, obviously within their limits.
Of course.
A healthy diet, managing stress, all these things can make a difference.
So as nurses, we're not just managing their medication,
Right.
but also helping them make changes that can improve their health in the long run.
You got it. It's a long-term game.
Yeah, it's a marathon, not a sprint.
Now, while we're working on that long-term management,
Yeah.
we also need to be on the lookout for signs of, you guessed it, right-sided heart failure.
Right, just like with the PE.
Exactly. It can happen with pulmonary hypertension, too.
So we're back to those key assessments.
Yeah, those assessments are crucial.
Checking for swelling, listening to the heart, monitoring those vital signs.
It's like being a detective, right?
Yeah, always looking for clues.
Looking for clues about how the patient is responding.
Exactly.
And don't forget the power of patient education.
Patient education, so important.
We need to help our patients understand their condition.
Yeah.
Recognize those early warning signs.
So they can be proactive.
Exactly, and feel empowered to take an active role in managing their health.
So it's a partnership.
It is, it's a partnership.
We're not just caring for patients, we're partnering with them.
Working together towards a common goal.
And that partnership, that's what makes nursing so special.
It is, it's what makes it all worthwhile.
It's challenging, it's rewarding, and it's so incredibly important.
Couldn't have said it better myself.
Man, we've covered so much.
Yeah, we have.
From fiery lungs to traffic jams to pressure cookers.
It's been quite a journey.
It really has. A deep dive into ARDS and pulmonary vascular disorders.
Essential knowledge.
Essential knowledge.
For any aspiring nurse out there.
Absolutely. And it's important to remember, behind all the medical terms,
Yeah.
behind all the procedures,
Right.
there are real people
Real people.
whose lives are being turned upside down by these conditions.
Absolutely. We can't forget that.
Yeah, and as nurses, we're not just treating diseases.
We're caring for human beings
We're caring for people.
who are scared,
Scared, confused.
looking to us for help.
And our sources really emphasized that a nurse's role,
Yeah,
it goes so far beyond
it does.
just checking vitals and giving meds.
It's so much more than that.
It's about being there for them.
Being a source of comfort, reassurance.
Or being that steady
Yes,
presence
absolutely.
in the midst of chaos.
Advocating for them when they can't advocate for themselves.
Listening to their fears.
Being that listening ear.
It's about treating the whole person.
The whole person, not just the disease.
And I loved that story
Me too.
about the nurse who sat with the ARDS patient,
Just holding their hand.
holding their hand, offering words of encouragement.
That human connection.
Yeah, it's so powerful.
It can be just as healing as any medication.
It really can.
That's what it's all about.
So as you guys embark on your nursing careers,
Yeah.
remember, you're not just learning about diseases.
You're learning about people
You're learning how to care for people.
with your head and your heart,
Exactly. And how to make a real difference,
even when things are tough.
even in the face of these really complex conditions.
That's what makes nursing so special.
And, you guys are going to be the kind of nurses
Yeah.
who provide that expert care,
That's skilled care.
but also offer that comforting presence, that compassionate touch.
It's a powerful combination.
And never underestimate the impact that
Never.
you can have on your patients.
A kind word,
A smile
a gentle touch,
can make all the difference.
especially when they're feeling vulnerable.
So future nurses, keep learning
Keep asking questions.
and never lose sight of that human element of nursing,
That's what it's all about.
because that's what makes this profession
Yeah.
so challenging, so rewarding.
So incredibly important.
And if this deep dive has helped you feel even a little bit more prepared
Even a little bit.
for those respiratory challenges you'll face out there,
Yeah. We've done our job.
we've done our job.
Blow out there and make us proud.
Thanks for joining us on the deep dive.
Absolutely.
See you next time.